Today I'll be showing you how to use the ICD-9 Consult on the Apple iPad. You can find this app on your home screen circled in red here. The icon will show up as a red book with a plus sign on it reading ICD-9. ICD-9 codes are used in medical practice for documentation and reimbursement of the specific diagnosis or treatment you're providing. Because there's such an extensive list of codes for these treatments and diagnoses, it is often necessary to look them up on an app such as this. Clicking on the ICD-9 Consult app will bring you to this screen. This screen provides an extensive list of diagnoses, starting at 001 and continuing to the 900s. It is typically easier if you have a general idea of what you're looking for, like the area of the body that's affected or the type of ailment that is occurring. When you have an idea of what you're searching for, you can type that into the search bar indicated by the black arrow. This narrows the thousands of diagnoses codes down to just a few, as seen here with rotator cuff tear, which is a common ailment found in my practice of physical therapy. When the results pop up, they will pop up with their ICD-9 code. For example, in this shot, partial rotator cuff tear is 726.13 and rotator cuff capsule sprain is 840.4. These codes will be documented in your paperwork for reimbursement. The same search strategy can also be used if you know the numbers for your ICD-9 code instead of words. This in itself can also be challenging. For example, in this case, 726 can vary from a shoulder ailment to varying types of elbow pain to hip and knee issues, which are all very different in and among themselves. If you don't know the exact name of the diagnosis or the numbers for the ICD-9 code, it might be useful to use this browse key indicated here by the pink arrow. By using this browse key, it divides the diagnoses up into different systems. So if you know that possibly it's a circulatory system problem or a respiratory system problem, something wrong with the lungs or the GI tract, which is the digestive system, this might help you narrow down your search. When looking up a specific type of procedure instead of a diagnosis, you would want to use the procedure key indicated here by the pink arrow. There are a lot less ICD-9 codes for procedures, so it's often easier to narrow down your search more quickly with this. When differentiating between procedures and diagnoses, the main difference is that a diagnosis would be what is wrong with the patient, whereas a procedure would be what you as the clinician or medical expert are doing to the patient to treat their ailment. The procedure ICD-9 codes range from 00 to 99.99. Just like for the diagnoses, there is also a browse key for the procedures indicated by the pink arrow. This browse key also narrows down the search to specific systems or parts of the body. So if you know what part of the body or what system you were working on, this would narrow down the search for you. Clicking on operations on the musculoskeletal system will take you to the next screen. The screen on the left with the blue circle indicates the next screen you'll come to. By clicking on repair and plastic operations on joint structures circled in blue will then bring you to the next screen. These steps will have narrowed down your search pretty far to where you can find the actual procedure that you perform. Total hip replacements and partial hip replacements are just two examples of common procedures that physical therapists will see in the clinic. When treating a patient who had total hip replacement, we would write down the ICD-9 code of 81.51, indicating that the patient has come in for physical therapy after a total hip replacement. And in our professional opinion, that is correctly what the procedure that they received. This screen indicates that if you did know the ICD-9 code and you could just type it straight into the procedures bar, the search bar, you would come up with the same procedure of total hip replacement. ICD-9 codes are very important to use in clinical practice because of their necessity in reimbursement. So if you don't know how to use the ICD-9 codes, it's very hard to make money, and that is why I find this app so useful and hope that you all will know how to use it now and can help you in your clinical practice.